So I think we should we start or should we wait for like 1 or 2 minutes for the rest of the participants? We have currently 86 participants, 90 we have right now. I think we should wait for like 3 or 1 and then we can start.
Okay, Adil, the limit has been reached for 100 participants, so I think you can start.
Yeah, okay. Thank you so much, everyone. Thank you so much, Arslan, for giving me floor. And I, I welcome you all on the day 2 of our Global Health Delivery project. So what we do is today we will have an active discussion with Laura Jung on the planetary health and its effect on the global health delivery. So I am Meher Mohammad Adil Riaz, the current VP CB of my NMO, and we will have active discussion as you guys have discussed with us and you participated actively with the discussion to yesterday also. So what you can do is if you have any question when the speaker is having his presentation and stuff like that, you can directly comment in the chat box so we can discuss that later. And Laura is joining us from Germany. She is leading the globalization health initiative of the BBD Germany. So Laura, over to you.
Hello, everyone, and good evening to all of you. Thank you for the invite. I feel very honored to be here. I think most of you already have turned off their cameras and microphones. That would be great if all of you could do that. I think then we get a better connection. Otherwise, if you somehow can't hear me anymore or can't see the slides, let us know in the chat so we can try to have the best connection to all of you. I'm now going to start sharing my screen so that I start with a little presentation. Okay, are you guys able to see my screen? I think so. Okay, perfect. Then I just check if I can still see the chat once I'm sharing the presentation. I think, yes, okay, perfect. Oh, but you see the chat now as well. You see it or you don't see it? Okay, then I remove it because otherwise it's getting too much. So we are going to talk about a very exciting topic today, that is planetary health delivery, or actually how the environment affects our health. And it's way more than just like natural environment, but like environment as a whole, seen from a planetary perspective, why it is important and what we can do about it. And right, I wanted to start with a little introduction about myself and my personal experiences with planetary health, because I just think it's really nice if, I don't know, you know a bit about me and where I'm coming from, since right now I'm actually at the other side of the world. So anyways, I grew up in pretty much in the forest and the mountains, like a region with very little infrastructure and mostly trees that you can see on the first picture. So in like a very natural environment, really not in the city. And I think that is something that also taught me to live with nature from very early on. And I later started studying medicine, and I also did a master's in public health at the London School of Hygiene and Tropical Medicine. I got in touch with a lot of people that were active in the field of climate change and health, which at this point in time was not a very familiar topic to most medical students. So So I then started to be active within BVMD and IFMSA, working on climate change and health, but also being active in an organization called the German Climate Change and Health Alliance, and which then later became Health for Future. Like most of you, I'm sure, know Fridays for Future, like the student movement against global warming. And in Germany, at least, or like other parts of Europe, we have a health movement as well called Health for Future. So I was very active there. I went to Bonn to the UNFCCC, which is the UN organization dealing with climate change. I went to a lot of demonstrations, basically advocating for a change from a medical perspective. And we're going to talk later about why it's especially important to do that with this medical perspective. And then later on, in the beginning of this year, I actually went to the World Health Organization. I did an internship there, which was not related to climate change, but antimicrobial resistance, which in the end is also affected by climate. So there is a lot of links in what I'm doing. And now currently I'm back to clinical work. Well, as most of you know, it's like COVID kind of directing all the clinical work we're doing right now. I'm actually based on an infectious disease ward that is getting most of the COVID cases in the region. So I'm also very close to this health crisis, and I'm going to have a look at this later in my presentation. Anyways, so far so good. That was a little bit about me, and you are invited to ask questions on that later. But now what I would like to know is actually a little bit about you. And please just write it in the chat so I can have like a very little idea about like, is there things you already know about climate change and health? Or how does climate change maybe affect your personal life? Or how do you imagine a sustainable healthcare sector? And those are questions you can write a few answers right now in the chat, but also keep them in mind for during the presentation. We come back to that after the presentation. So yeah, if you just like could write down a few things in the chat on like your thoughts on climate change, that would be very helpful. And also please turn off your microphones at this point. Oh yeah, and like don't be shy. Like it's very hard to make an interactive webinar with so many people, but let's all try our best. So just write little things.
Sorry, Laura, to interrupt. Guys, please mute your mics because apparently she's discussing very important topic. And yeah, thank you so much. We would highly appreciate if you will mute your mics. Laura, over to you. You can continue. Thank you.
Perfect. Yeah, there is like the first things coming in of like thoughts on climate change and health, on like pollutants and definitely like air pollution and respiratory systems. And we're going to come back to this. It's like a very, very big issue. Climate change, how it changed the global ecology. It's a very important topic, especially when we're going to talk about pandemics and COVID later on. And yes, temperature, that's a very good answer. Climate refugees, this is so important. And destruction of the food chain. Someone still has the mic on. Try to turn it off. Causes to be more susceptible to diseases. That's also a very interesting one. As a disturbing factor may cause for destruction of human life in the future. That is definitely one of the messages that the health sector is sending out right now, that like all our lives will be changed by climate change. And it complicates our journey towards UHC. I think that was a very good last sentence to that. Definitely true. So I see that most of you have a little idea of what climate change is doing to our health. And I'm gonna talk about that a little bit more in going into climate change as a health emergency. So what actually is climate change? Climate change is what we call, or what the UN calls, a means of change of climate attributed to human activity. And that is important. When we talk about climate change as we do, we don't talk about what is a natural change of climate that has always been occurring through the history of the planet. When we talk about climate change, we mean really the part that is changed by human activity, by industrialization, by our means of transport, and our use of fossil fuels. This is very important to take for us. And climate change was actually seen as the biggest health threat of the 21st century. That also mirrored a bit what you said in the chat. And nowadays, we also try to give it a second component. And this second component is it can also be the greatest global health opportunity of the 21st century. And we are trying to find out what that actually means. Global warming, yes, that's what it makes. It's like through an increase in CO2 in the atmosphere, it's getting warmer on this planet. Since I was invited by IFMSA Pakistan, I found the warming stripes, it's called, for Pakistan. So it's the annual average change in temperature that has occurred between 1901 and 2019. And what we can see is that on this scale, the temperature is increasing. And I know there is like quite a few students from India as well. Those warming stripes actually exist for nearly every country in the world. You can find them online. And it's really interesting to look at because that makes clear that really the climate is changing. It's not just a feeling that we have, but it's actually happening. And what does that mean for us is we have those projections, right? There is a projection if humans don't change anything and we just keep living like we do right now with the current idea of growth, then the global greenhouse gases will further increase until 21. And yeah, there is basically a baseline increase in temperature of up to 5 degrees. Some scientists say even more. So if we don't change anything, that's where we go. And that will cause a lot of problems for us. And we need really good policies to actually get on this green line, because what countries have decided on in the Paris Agreement, which is one of the most important agreements on climate change, is that we don't want an increase in temperature for more than 1.5 to 2 degrees. So this is becoming very, very difficult with what we are doing right now. And that is also why we need to be very aware of that and get active. So what are now actually the links between climate change and health? For a very, very long time, at least in Europe, when we were talking about climate change, we were usually talking about icebergs and penguins that suffer in the Arctic regions. And that didn't really touch people as much as it maybe should have. So the question is, if we talk about climate change and health, can that really reach more people and reach the interest better? Are we doing that yet? The answer is not really. As you can see here, those are published articles in journals on the matter of climate change. Those are published articles on the matter of health, and the overlap is minimal. It's minimal, and it's not a topic that had yet been reaching the medical community. As you probably know, because like climate change and health is not taught in medical schools. It's never a topic in hospitals, obviously, and even in public health, it rarely is. So there is a long way to go, because we know climate change is a health problem. It has been recognized by the World Health Organization, for example, and by most big medical organizations by now. So what are the health impacts of climate change? You guys actually already mentioned quite a few and like very interesting ones. Like air pollution is increasing. And you also already mentioned indirect impact of climate change, like for example, that we're going to see more climate refugees, which is a very important factor as well. So basically, climate change really affects everything. Air pollution, we talked about, it's like a very big problem. It's a problem here. It's probably very much a problem for you guys as well. heat. Yes, I don't even have to say too much to that. I think all of you noticed how much it's getting hotter. Where I grew up, when I was a child, we still had snow in winters. It's basically gone. It's like very rare now that we still have snow. Then there is droughts and floodings at the same time. That might seem a bit funny at first, but it's really what happens. What we see is like over a very long period, we have droughts, we have no rain at all, and then we have a lot of rain at the same time. We have an increase in storms, increase in hurricanes, increase in also like the monsoon rain, and it actually makes agriculture kind of impossible. Some of you might have like a background or family background in agriculture, and it's like getting very, very hard. Infectious diseases is a big one. And like I'm a bit into infectious diseases, so I know a little bit more about that. What we know is that infectious diseases increase, especially those vector-borne diseases. Vector-borne means there is like a little vector that we have, like a mosquito, for example, or a tick. And those mosquitoes, until now, they could only survive in certain areas. And now what we see is because of the change in climate and temperature, they suddenly can survive in a lot more areas. Like now, even in the mountains, we have that. Even in North Europe, we have them. And suddenly there is a lot more regions that are affected by malaria, that are affected by dengue, by Zika virus. And so we really see the first changes there in the infectious disease pattern. So that makes a big difference. And all those wildfires is also a very big one for a lot of regions. That is devastating because it's destroying people's homes, it's destroying cities, and obviously people are dying in the wildfires. And those are the direct impacts. And then there is indirect impacts coming from that, like a disturbed mental health of people. A lot of people have to flee their homes. They have to move, go somewhere else. The issue of climate refugees is a very big one. A lot of the infrastructure collapses, healthcare system collapses as well. So we really see that a lot of parts of our health are affected by this. I have that summarized here. It's a very good graphic that comes from CDC, and that really says like it's affecting respiratory diseases, it's affecting cardiovascular diseases, infectious diseases, non-communicable diseases, malnutrition. It's basically everything is somehow linked to climate change. And that's why it's so important that we talk about that and that we get better in understanding it. And this is something that is very close to my heart and probably even more important for you. And that is climate change does not affect all of us equally. And I picked this map randomly, but you can take most maps on climate change impacts and they will all look a bit like that. So what we see here is potential like hours of labor lost due to heat exposure. So it was too hot for people to work. How many hours in the year was that? It's from 2018. What we see is there is key regions, that is sub-Saharan Africa, that is India, Pakistan, and like a bit of Southeast Asia. Then there is a lot in South America as well, usually. And if we take other maps that are about droughts, that are about floodings, a lot about temperature and infectious diseases, it will always look kind of like this. So especially the central region of the planet is mostly affected. And this is actually dramatic and this is unfair because this is the region in the world that has the least contributed to the use of fossil fuels and that has the least benefited. Because when we look where like all the fossil fuels have been used, what we see is the US, North America as a whole, and Europe and Australia. And those are really the regions that are the most responsible for what is happening. And those are not the regions that are the most suffering. So climate change is really an equity issue as well. And it's really important that we see that because it's just not fair. And it's make a lot of people suffering in the world, and the people who are responsible are not seeing it because they are too far away. So this is something very important to keep in mind. As a short conclusion of that, what we can say is really, if we don't protect the climate, we are really cutting off the branches we sit on. So protecting the climate means protecting health. And now we're coming to the good news, and that is living climate consciously is also healthy. A lot of the health issues that we are right now is on the side of non-communicable diseases, and that is the same all around the world. And there is a lot of means that make us live more climate conscious that are healthy at the same time. I have like one example that is active transport, which obviously needs some prerequisites, making it safe to participate in active transport and so on. But when we cycle or walk or even take public transport, this activity reduces the risk for non-communicable diseases. It is a reduction of air pollution and noise compared to when everyone just like a single person sitting in a car, and it's improving our quality of life and our mental health. So, and there is other examples to this, like especially on the part of diet and what we eat, like the food that we eat, where we can really see that living more climate conscious makes us more healthy. And I think that is really the opportunity that we have and that we can keep in mind, and that makes sense for us as doctors to also promote climate consciously living to our patients, because we know it also makes them healthy. So what are the solutions that we need to make our planet survive, to make us survive, and to actually have a healthy future? The most important is energy. So we need energy that is not burning fossil fuels. So that means no oil, no gas, no coal. Mainly coal. Coal is really the biggest threat to the health that we see. It's indirectly because it's burning fossil fuels, and very directly because it's contributing to air pollution that much. Green cities is a very important one, because more than half of the global population nowadays is living in cities. Most of you guys probably live in cities as well. And we need, therefore, to think about smart solutions for making cities more sustainable, more green, and more livable. Clean cooking is a very big one. Not so much in Europe, since here most people have indoor, like electric kitchens, but way more in probably where you guys live, Southeast Asia is a big topic, and Sub-Saharan Africa, where not everyone has electric cooking, but people use indoor fires, is very much affecting the health mostly of women and children due to the air pollution that it produces and that stay inside. So this is a very big one as well. And then sustainable agriculture is something that we really need to work on. So far, so good. But also we as future health professionals need to get active against climate change. I put this photo that's from a demonstration that we had here at home, actually. So it's a pretty nice memory to me. And it's really good to see how many like health professionals come together and see that as an important issue already. But now we want to talk a bit about the health sector and talk a bit about why actually do we need to be active? Why is it our responsibility as health professionals to do something? And there is some simple reasons to that. So first of all, because it will affect the work that we are doing. With all the health impacts that I just mentioned, we will be seeing an increasing caseload. We will be seeing more patients with consequences of climate change. So if we don't act on climate change, we actually just increase our own workload, which is like a very practical reason to get active. Secondly, climate change consequences will disrupt healthcare systems. They will basically also destroy our workplaces. Because after a flood, after a wildfire, after a storm, like maybe the hospital we worked in will not be there anymore, and we have to find other ways to get our care delivered. So it's really important. We're just making our own work hard if we don't act on climate change today. Third one is very important. You as a future healthcare professional are extremely trusted by the population, and your voice, if you express it in the right forum, can have a significant impact on public policy. There is a lot of distrust in the population against politicians, for example, against other people that publicly speak up, but doctors are usually very trusted. So that is something that we can use in our favor to push this issue in personal talks with the patient, but also on a broader scene, speaking up for everyone. And then the fourth one, it's a bit, if you're interested in public health practitioners are very good in designing policies and create healthy environments. But the behavioral changes have also need to happen on an individual level. So really, you as a doctor, you can change the life of your patients, and you are the one that can make patients aware of why it's important to work on that. There is another very big reason, and that is the healthcare sector is a part of the problem. What does that mean? Overall, the healthcare sector globally is responsible for about 2,300 tons of CO2. So that's about 5% of the global total emissions coming from the health sector. So yeah, we also kind of need to tap on our own noses and see what we can change. You can see that it's obviously very different, that it's, again, the European countries contributing a lot, the Western Pacific countries, and I think there is Australia amongst them, contributing a big lot. Southeastern Asia, actually not that much, or they don't have enough data provided, so they are maybe not included in this analysis. And yeah, we see one world leader in emissions, like probably has the dirtiest health sector of them all, that's the US. So what can we do about that as healthcare professionals, as medics? On a patient level, it's important to really promote the sustainable lifestyle. If there is a way that you can change your life to make it more climate friendly and more healthy at the same time, that's a win-win. That's a win for the patient, a win for the planet. That's amazing. We should always opt for this option. Be a role model. This is very important because, as I said, doctors are very trusted in the society. And if you change things for yourself, other people will follow. Practice green healthcare. This is actually difficult because we need more systemical changes for it. But as young people, especially, we can advocate for that. We can ask for that. And it's important that we push it. Like, we are the new generation coming up, and we are the ones that will suffer the consequences. Like a 60-year-old doctor right now, he might care less because he knows that when it's becoming really bad, he's dead anyways. But us, like, we are gonna be very much affected. It's really just in our own interest. It could be called egoistic in that sense, but it's probably a bit more. Changing the policies and the environment by advocating for climate action, that is something that we really need to work on as well. And that is something IFMSA is doing and student organization is doing, so we can get there. Green hospitals. There is actually a quote of Tedros that most of you might know as the Director General of the World Health Organization, who says, places of healing, so hospitals, should be leading the way, not contributing to the burden of diseases. And that is exactly the idea. Like, we need a good green healthcare so that because we are the one that want to heal patients, not the one that want to make them sick. So we should try to not contribute to make more emissions than necessary. That goes about many ways. It's chemicals are involved in that. What are we using? For example, the narcotic gases that we use for anesthesiology is one of them. Could you stop like writing on my slides? That would be very nice. Is one point. The energy that we use for the hospitals, the way that we manage waste is very important, and food in the hospital as well. So there is some points of care that we can tackle this way. Resilient hospitals. This is another very important one. Why is it important? Because we know that hospitals and the healthcare sector will be affected by climate change. So we need to make assessments of what are the vulnerabilities of our hospitals and make plans on how we can strengthen the system. Or for example, also how we can strengthen the building. Do we need air conditioning in the building? Do we need to make it safe for floodings or wildfires or whatever is the issue in the region where the hospital is in? So that might include redesigning facilities and also disaster preparedness. So it's two things. First of all, the hospitals should not contribute to increasing climate change. And second, the hospitals need to adapt to be ready for what's going to happen. So now a bit on what students can do. And I brought a few examples from IFMSA. First of all, there is a bit old training manual on climate and health that has different activities. Still worth a look, We also have a policy, an IFMSA climate change and health policy from, I think, 2018 that gives you a lot of the background knowledge. So if you're interested in learning more, that is one way where you can go. Student protests is very important. And what we figured is very effective is that we go in white coats so that we show that we are medical students, health professionals, whatever, so that everyone can see that here is the health sector saying that climate change is bad for health. Very good. IFMSA is also active politically, going to the UN conferences called COP conferences of the party that have where the decisions are made on that. So if you want to politically engage, you can look into that. There is different meetings throughout the year where you can participate. Then there is an IFMSA guideline on sustainable and climate friendly meetings. This is a bit about being a role model. Basically, you have to do a bit what you preach, and there is ways to make the meetings that we have more green and more climate friendly. If you need help on how to do that, those recommendations are very good for you. I think they were first used for the General Assembly in Montreal. And then there is like very interesting activities that national organizations do. For example, CFMS Canada, they have HEART, which is their climate change project, and they did a national report on planetary health education. So they analyzed all the activities that, basically all the curricula of the medical schools, and they looked at if there was climate change or planetary health included, and they made a ranking out of that. And their idea is to advocate for more inclusion of the topic into medical studies. If you have questions, you can just contact them. They are very open talking to you. Here in this picture, you also see Omnia, who is the liaison officer for public health issues in IFMSA, and she is very much involved into climate change and health issues as well. So you can contact her at any time. I don't know why I make so many colorful things on my slides.
I'm sorry, who is doing that? Who is making this slide?
So I collected a few resources for you guys that I can also send you after the session. So here is general resources on climate change and health. Then there is resources on green healthcare. And then I collected all the IFMSA resources so that you can just click through them and get a bit more information. And then one more little chapter, and that is COVID-19 and climate. It's very close to my heart because I think COVID is affecting all of us, and climate change is also affecting all of us, but it's perceived very differently in the population and globally as a whole. On COVID-19 is something like the virus was basically discovered in December last year, and so much has happened since then. We have seen so much of political action, has been good, has been bad. I'm not going to judge that, but we have seen that all the governments were suddenly able to do things. All the populations know about it. They are somehow affected, and it's very interesting. And then there is climate change, which we say is a very big health threat. It's a threat to our lives as well. And basically nothing happens. So it's very interesting to look at those two combined, but also they have a bit of link of how they are getting together. And this link is biodiversity. That is because more than 60% of the emergent, that means new diseases in the infectious disease sector coming up, are zoonoses. So they are coming from animals to humans. And there are key factors for the increase of infectious disease outbreaks, which are, first of all, changes in the habitats of wild animals. So through urbanization, there is a decrease of natural habitats for like those wild animals. And therefore, they have an increased contact of humans. So humans are more in touch with natural ecosystems, but also their diseases or the disease vectors. And that means because we're taking away so much space from the natural world with our like infrastructure, our cities, there is a higher risk that we get infected. So there will be more of those outbreaks in the coming years, in the coming decades. It's not going to stop after that one. This is something that is very important for us to understand. And unregulated trade of wild animals, obviously also a big part of that. That's why it's banned in many regions of the world. So what does that mean? It means protecting the climate must include protecting the biodiversity. And this all results in health protection. So it's, again, it's not about animals, it's not about endangered species, it's really also about health protection, and that means human health. So therefore we have this concept that is called planetary health. It's not only the health of humans, but the health of humans and environment and the planet we live on. And this can only function in a world where we live together within our planetary boundaries. So where we don't use more than the planet can produce. And right now, humanity is not doing that. Just a few days ago, we had this one day of the year where we actually used all the resources that the planet can produce. But it's only end of August. So that means there is 4 months left where actually we are living over what the planet can produce for us. And it's obvious that this can't go on for a very long time like that. And there is a few spheres where we already have been over the planetary boundaries, and genetic biodiversity or biodiversity is one of them. There is a lot of species being eradicated every year, and we have to trying to protect them a bit better and finding spaces where we can live together. So what is the issue with climate crisis and COVID? So there is the concept of compound climate risks, which mean the consequences from COVID-19 and climate change are actually multiplicated. So one example is heat waves. Heat waves and COVID-19 infection have similar risk groups. It's mainly affecting old people or people that have already preconditions, cardiovascular or respiratory. So those groups are now on a double risk if we have a heat wave during a COVID outbreak. Also, the classic response mechanisms that we have, that we use in the case of, for example, a heat wave or a wildfire, where we try to evacuate people, put them together somewhere in safety outside their house, usually brings together a lot of people in a closed space, which again is not the best when we actually try to prevent COVID by everyone staying in their own home. And also there will be an increased use of healthcare facilities. COVID-19 needs a lot of resources, but the climate change consequences as a heat wave also needs a lot of resources at the same time. And that's where the problem starts. We actually can't afford those kind of risks coming together at the same time for our health. There is also a big burden on healthcare professionals, and that is something that I really have been experienced on my own life, and that is when you work on a COVID ward and you're wearing all the protection, and we are very lucky that we have the protection, not to say that, but you have a full suit, you have a mask, you have goggles, you are wearing double gloves, and then there is a heat wave outside, means you're losing so much water, you're sweating so much. Basically, after you leave the COVID patient's room, you're ready to shower because it's just too hot. So there are issues where the climate risks really come together with the COVID risks and make life for everyone harder. There were a lot of ideas that actually maybe the climate could benefit from COVID-19. We thought we see less air pollution, for example, and the emissions would decrease. It happened. Here you can see Italy in March. You see the air pollution decreased a bit because they were all in lockdown. No one could go out. There were like thousands of people dying as well. It was not an ideal situation, we have to say. But yet the air pollution decreased a bit. However, this is only a temporary effect without permanent measures. And the emissions for this year are still projected to increase. So emissions are still not falling, which is a very big problem. And the lockdown was also quite bad event for most of us. I don't know about you, but it's a massive decrease in quality of life if you're locked down, if you have to stay at home, you can't do anything. That is not how we actually want to live. So the idea is that a back to normal, just a back to before, can probably not be the solution. What we need to do instead is to use this window of opportunity that we have right now. So we need to take the chance and advocate for a green and healthy recovery, which means a climate-friendly path forward out of the crisis, instead of just going back to doing those things that we have been doing before and that have been contributed to leading us to where we are right now. And the idea is really we need to decrease the probability of similar events happening. Because as I said, if we go on like this, if we reduce biodiversity, there will be more outbreaks, there will be more epidemics and maybe pandemics. So we need to work on that if we don't want to be in lockdown every few months again. And for example, the World Health Organization has written a manifest for healthy recovery that is really worth looking up. You can just Google and you'll find it, where they talk about how we can go into a more healthy world from this starting point. And for example, Ursula von der Leyen, who is the president of the EU Commission, she said, sooner or later, we will find a vaccine for the coronavirus, but there is no vaccine for climate change. We need a recovery plan that is designed for the future. And I think that is really what all of us really need to be aware of, that if we want to have a future, if we want to have a future for our children, we need to work on that right now, because time is pretty much running out. So the idea is with COVID-19, all the time we have been discussing about flatten the curve of the infection, flatten the epidemiological curve. But we also have to flatten the curve of climate change in the way that we need to be more sustainable, and we can't go on as we are right now because we have to stay within the planetary boundaries. Otherwise, we will all suffer from that. Health will suffer, the health sector will suffer, and for us, it's just reasonable to work on that right now so that we have a bit of a better position for what is coming towards us in the next years and decades. And that is the end of my presentation.
Thank you so much, Laura, for your great insight into the planetary health and how it is affecting the region, especially it is affecting our region, Southeast Asia. So I think we should move towards the questions which we collected through the pre-evaluation form and the registration. So my first question to you, Laura, is give us the basic introduction of global health. Like, you are one of the leading members of Globalization and Health Initiative of your NMO. So how you started your journey, and what is global health according to you, and how it is, practically, how it can be practically translated into the health systems and its global health delivery process. Thank you.
Thank you very much. Global health for me is a very interesting question because it's actually something that we are discussing a lot. There is not such a thing as a very good definition of what global health is. So everyone needs to find a bit of their own definition, I guess. And global health for me really is a perspective that let me look on health issues from different perspectives, like including a biomedical perspective, but also a social perspective, an economical perspective, a historical perspective, probably, and a social science perspective, and to really like get a broader view than what we are usually been taught in medical school, where we very much focus on diseases, on symptoms, and how to treat it. But there is so much that is not covered by this idea that we have been learned in medical school. So global health is really kind of going over that, or like, let's say, take a step back and look at the problem from many different sides to see where it's interlinked with other issues. And then understand how we can actually maybe even change it, which is usually not with only drugs and the hospital treatment, but to really understand that health is more than what happens in the hospital, and that the health that we have in the place where we practice is affected by the health elsewhere around the globe. Like, we are so interconnected in the world we live in that we can't only practice in our little corner without thinking about what is happening on other areas of the planet. And I think that the current pandemic showed that very impressively.
Yeah, thank you so much for your reflection on what is global health, because eventually it is the more personalized version of the global health that can be implemented towards the their health system, because we are coming from different backgrounds and different area, and we have to understand our geographical statements and understanding of the patient, so we can implement that into. So that leads me towards my second question is, I am also pasting that in the chat box, so if you guys want to read that also. So So my second question to Laura is, what techniques are actually effective in raising public awareness and actually implementing rules and laws regarding planetary health, and especially for when we talk about the universal health coverage and achieving Agenda 2030? So what are the tools you think are effective, because you have been there? And
yes. Yeah. Thank you. So that is seems like many questions in one. I'm going to start from the beginning. What are techniques in effectively raising public awareness on planetary health and the Agenda 2030? I think like one very easy answer to that is it's us. Like one very effective way to raise the awareness is young people standing up for what they believe in is important, and to advocate for that and to actually ask for that. Like we're in a position where we can ask for things because there is like this saying that basically means that changes are usually not coming, or that solutions for problems are not coming from the same people that caused the problems, but the solutions have to come from someone else. So in this case, maybe solutions have to also come from us. And awareness is the first step to change things as they are. So to raise the public awareness, I think it's important that we as students, we ask for having it included in the curriculum so that all of us at least know it. And then to talk about it in public, but also in private. And that can sometimes be the hardest part, talking to your families about climate change and planetary health and how it's important, talking to your friends about it. And not all of them will like it that much. Like I have members in my family that don't take me very serious when I speak about that, like older members or like friends that don't find it that important. But my advice on that is don't give up and try to change in private as well as in public. It starts with you. And then, yeah, planetary health and the Agenda 2030. So the Agenda 2030, and I hope all of you kind of know what we're talking about, because it's not something that all medical students usually know. It's something that has also not been taught in medical school, even so it's a very important concept in global health and in the UN system in general. The Agenda 2030 is about the Sustainable Development Goals. And therefore, it's actually about our future and how we can live healthy in the future, and maybe also how we can even exist in the future. So I firstly would recommend kind of try to read up on that, try to understand why it is so important for us. And then again, it starts with you raising the awareness.
Yeah, thank you so much for your great insight into the actual tools that goes into raising awareness and implementation of the process. Now that moves me towards my third question is, the participant is asking, what are the basic infrastructure that should be provided in order to maintain the basic sanitation of the people? Because and you know that is related towards more related to the water, but I think that eventually is the part of the climate change process. Because I just want to reflect on this point is because we need to understand the demographics of India and Pakistan, because eventually near 70 years back we were the same country, including Bangladesh and stuff like that. So the common source of water comes from Himalayas, Hindu-Kush, top north of the situation, and the glaciers are melting at an alarming rate in both the regions, and both regions face the flooding and the monsoon. Am I audible? Sorry. Am I audible?
Yes.
Yeah, okay, thank you. And both the regions, you know, face the flooding and the situation both in the same era of the year, like in late July or early August in the monsoon year. So it eventually becomes a problem to the access of the clean water to the major population areas of the world. So I think, because you have a master's degree in the public health, so what are the basic infrastructure that government should provide to their people in order to have you know, access to the clean?
It's a very important question that falls in an area that we call WASH. This is water and sanitation, and that whoever asked that question is really great to talk about that, because it is so important. And as you said, especially if like climate conditions change, we have more of those floodings. Interesting enough that you talked about glaciers. I I actually visited the glacier in a few months ago, and I was saddened. It was so hard to see how far you have to walk until you reach the glacier, and how much bigger it was only 10 years ago. And then we really see like climate change in front of our eyes by seeing how our environment changes. So I can very well imagine how there is like increased flooding in those areas. And the infrastructure is very important. I mean, the infrastructures that we're talking about is mostly canalization systems that are made safe for floodings. So basically, if we plan a canalization system for a city or a village right now, we have to think in the future. And that's actually true for all the infrastructure that we build right now. We are not building them for the situation as it is right now. We're building them for the situation that we are facing in 5 years. So, or maybe 10 years or 15 years. But we really have to, when we make the plans today, think about how is the climate changing and how do we have to adapt? How can we make a canalization system that is actually safe from the floodings, that will still function? So what that means is it's a very interdisciplinary project. We need engineers, we need experts for city planning, we maybe need doctors as well, or like at least public health professionals, and we need specialists for the climate changes that we will see in that area. So we need a lot of different professions that come together for like actually a project that sounds that simple. But we need all of them to make it resilient for the future, because otherwise it's not going to be worth a lot. And we see that especially water is changing a lot. It's not only the glaciers melting, it's actually the Arctic and the Antarctic melting. It's a rising sea level that we are facing. Most settlements that humans build are somewhat close to water. There is a lot of islands, especially in the Pacific, that are very scared of what's going to happen to them. There is big and rich European cities that are very scared of what's happening to them. Like I think Amsterdam is built under sea level. There is obviously a lot of cities in Southeast Asia that are very scared of what is going to happen to them. And we really have to incorporate that in our thinking today, that probably the environment around us is changing. So it's important to include a lot of different professionals in the plans that we are making right now. And public health should always be a part of that.
Yeah, thank you so much for introducing the multidisciplinary approach towards the water sanitation process that goes into that. So that brings me towards my next question is, how far you think this practical action on the planetary health will eventually leads towards the prevention of the diseases? Like eventually we have to lessen the burden of the diseases on the health system, and in order to, prevent more and spend less on the actual treating of the disease.
Mm-hmm. Interesting. Well, yeah, I'm really public health enthusiast. So from this side, I say prevention is always better than treating. And as we know, it's also way more cost effective. Usually we save money if people don't get sick in the first place. All right. So this is something that we need to consider. But there is also another thing that we say, and that is there is no glory in prevention. And what that basically means is you don't see the deaths that are prevented. You don't see the sick people that have been prevented. So it's very hard to measure how good your prevention measure was, because you don't see what you have avoided. However, like we know very well that prevention is cheaper, prevention is better, and prevention is going to make all of us healthier. So it is obviously we need to carry on thinking about treatment, thinking about clinical care, but we are already doing that a lot. there is a lot of resources going into clinical research. And compared to that, there is very, very little going into prevention. Even so, we know that prevention is maybe, or probably the better option. It's usually less attractive to policymakers, to funders, so that there is less money going there. So in my opinion, I think prevention is going to bring us very far if we take it serious.
Yeah. Thank you so much, Tara, for your answer. Now we have received a direct question in the chat box. Abshar Ibrahim says, as a climate change advocate, isn't it necessary we talk about the impact of nuclear wars on the climate, because it is a main reason for such huge climate change in short span of time?
Mm-hmm. Okay, thank you for that question. So just to get like a few of the definitions clear, talking about nuclear war is important by itself, also not related to climate. Talking about nuclear war or about how we can avoid any form of nuclear damage to humans is very important. And there actually is also an organization for that, and I think they won the Nobel Peace Prize at some point. It's the IPPNW. It's like the International Network of Doctors Against Nuclear Weapons or something. I don't know exactly, but like something like that. So that is really important, as like I think every health professional should be very deeply against nuclear weapons, just because of the high power of destruction that they bring and the health threat that they are. They don't necessarily change the climate. What they do is they change the environment. That doesn't necessarily is a long-term change for the climate. It's a very big environmental change of the reason. That's a bit the difference. So I wouldn't necessarily talk about it as a form of climate change. However, I think it's very important to talk about it and to make clear that it's something that we really don't want.
Yeah, thank you so much. Actually, the organization you are referring to is based in, I think, Italy, and it is in direct collaboration with IFMS's CARB Standing Committee and the International Disaster Training or Disaster and Human Management and the Nuclear War. They actually give that to the people. I think that is that organization that is made by healthcare professionals, and it won the Nobel Prize also. So we received a direct question again in the chat box. Priya says, how do zoonotic diseases find an appraisal due to the climate change pathologically, and how does it manifest in different human populations?
Mm.
So
it's a very good question. But I try to answer the best I can. So zoonotic diseases, from what we know, there is one kind of animal that is very very good in producing those diseases, and these are bats. It's bats because they are like some of the only animals that live in so large groups on very little space, because they usually live or stay in caves, and like really in like 10,000 or 100,000 in those caves. And that's where the viruses are very happy to live as well, because they have so many possible victims. They don't even need to be careful. Like in those like bat colonies, you're not going to produce a virus like HIV that needs 10 years or 20 years to manifest. You produce something like COVID or something like Ebola. And that's what it makes very dangerous. Something highly infectious that's getting where you see the symptoms very quickly. Now what happens is, most of the time that we lived on Earth, bats lived wherever they lived and humans lived wherever they lived, and they haven't had that many close contacts. But now, since there is a lot more overlap between the places where we live, mainly because humans take just all the space for them, and they're reducing wild habitats to such a very small, very small amount that is actually left for the animals. there is a lot more overlap and a lot more contact between humans and wild animals. And that is how infectious diseases spread more and more easily onto humans. So it's mainly this loss of biodiversity and loss of natural habitats that make it more likely that we are seeing more zoonosis or more zoonotic infectious diseases coming up right now. And that is actually very well proven. If you're interested in that, like just Google and you find a lot on that.
Yeah, thank you so much, Laura, for your answer. Actually, we also received one more question in the chat box. They're asking, does the vegan diet actually have a positive effect on the climate change? Like it decreases the climate change and stuff like that.
Diet change, right? That's the question.
Yeah. They are asking about like what is the impact of vegan diet on the
yeah, it is. The simple question, yes, it is. Red meat is a very big contributor to climate change. As you know, like there is problems, especially with the cows and the cow farts. There was a lot of media around that. However, it's true that first of all, the animals that we keep for eating the amount of meat that we are currently eating globally, that is just insane. They need a lot of space that can't be used for other things. They need a lot of water, way more than we used to produce a plant-based diet. So they have a lot of, well, first of all, direct effects on the emissions and also indirect effects in the way that they reduce natural habitats and biodiversity. So the simple answer is clearly yes, plant-based diet is better. There is even something called a planetary health diet. So a form of diet that is the best for the planet. It doesn't say you're not allowed to eat meat at all or animal products at all. I am personally mostly vegetarian. But it is actually okay to eat a bit of animal products, especially if you know where they come from. So like the best is you buy directly on a farm, because the problem, where the problem is coming from, is like those mass shelters for animals that we have and where we keep them in like very close proximity, which is also actually bad for the animals, usually also very bad for the people who work there. So there is a lot of issues around that. So yeah, from my point of view, I think a plant-based diet is like one of the very big contributors to a more healthy world. And if you're interested, check out the Planetary Health Diet.
Yeah, thank you so much. I just want to add a few points here. There was an article a few days back when only the United Kingdom was producing, the livestock production of the United Kingdom industry was producing more gas emissions than the combined, I think, India and Pakistan. I think so. There was an article on that. So we need to look on that. You know, the most area that are struck by the climate change are the South America, which we call as Latin America, or, you know, the Southeast Asia, like India, Pakistan, Bangladesh, and areas like that. So we need to really understand the process that goes into talking of the vegan diet and the red meat. The biggest production of beef is number one is Brazil, and number second is India, that is exporting the beef outside of the country. And these are the two major countries that are struck by the climate change. So we need to understand the chronological impact of their livestock, industry on their long-term impact of their thing. So yeah. So I think we will move towards our next question. Is that what is the future of global health? Would rural health areas be the part with urban health in global health systems? So they are just talking about, creating the imperative between rural and the urban areas, because in India and Pakistan we are talking about more than like 60% or 70% of the population lives in rural areas. So there's a much of the difference between the healthcare service delivery between the rural and the urban areas. So they're asking what will be the impact of that?
So yeah, there is definitely differences between healthcare delivery in urban areas and cities, urban areas, like rural areas and cities, obviously. And it is very much, to be fair, it's hard to give a universal answer to that, because it's very much depending on the context and on the options that you have. What we usually see is that the rural populations are underserved. They don't have access to the same amount of healthcare as people in the cities often have, just because they are far. They need to use a lot of transport to get to places, which is expensive maybe in the first place, and also hard because they are far away from where they actually live, from their families, from their workplaces, etc. So we need to get kind of better concepts on how we can provide integrated healthcare. And now what we see is that, or like what a lot of people are working on, is how can we use technical devices to help providing care also on rural areas. It's not my main area of expertise, but we're doing that here as well, where we try to have more consultations, especially with specialists, right, that you don't find everywhere. But we try to do the consultations on the phone or online, and to set those services in place so that wherever you are, actually, you can have access to high quality care. And it's like obviously not the same as if you have it right in front of you, but maybe it's the best we can get, and we really have to work on improving the status quo as it is. So there is ways to go, and it's probably even a climate-friendly way to use more technical devices, because it saves us a lot of troubles.
Yeah, thank you so much, Lara, for that question. Answer. So there is a comment in the chat box. We were talking about planetary health, diet, and stuff like that. So one of the participants asked that, aren't most diet based on the regional variations in the climate and food availability? How can we decide upon a common diet for everyone on the planet? So yeah.
It's a good question. I think I didn't make that clear enough. So basically, the recommendations are not saying you should eat like that specific dish, because you're right, that's like based on like cultural specifics, but it's probably like suggesting how much meat you should eat, or how much fish, or how much vegetables, kind of, or how many like sources of carbohydrates. And then different cultures have different sources. Some have maybe more rice, some have more potatoes or other plants, some have more pasta, whatever, or more bread-based stuff. But you can categorize them broadly, and like that is what those recommendations are based on categories that should work for different cultures as well. And they are not very specific, telling you what exactly to eat. And then there is always like cultural translation if you want needed. And I just going on, that means there's a balanced diet model at the end. Yes, exactly. Like the idea is also, it's not only what you eat, but also, for example, where it comes from. A lot of the food that is, well, as you said, for example, a lot of the meat is produced in Brazil and then shipped around the world to Europe, to China, to wherever. So that also contributes to a bit to how climate friendly it is, right? Like where it comes from. However, it's really, the type of food is still more important. So like, I think eating meat, even if it's coming from next door, is still worse than eating no meat.
Yeah, thank you so much. So actually, when I read that article, I felt very, certain type of way, because the peaches produced in Argentina were first shipped towards Thailand for packing, and they were packed in Thailand, and then they were sent again back to the South America for selling those products. So eventually, we are producing one thing at one end of the world, and we are shipping that product at the other end of the world for just packing, and then we are shipping again that product to the same country for selling. So the system is, messed up. We need to understand the system, and we need to raise our voices, as you said that, and we need to highlight those things.
Yeah,
So that
buying regional is definitely an issue, and also buying or like eating seasonal. Like nowadays, there is a bit the idea that I can or I have to have the option to eat everything I want at the time that I want. That is not very natural. Like here we have quite a still like strong winter, and like there is just things that in winter shouldn't be available. They still are because we ship them from somewhere else. But there is actually like ways of eating where you adapt a bit more to what there is naturally in your region at certain types, or like certain times of the year. So this also could help a bit.
Yeah, thank you so much. Yeah, sure. I will send the link of that article. I will search for that because I read it somewhere on the internet. So yeah, sure. After that, I will search and I will send it into our participants group. Now that brings me towards my next question is, considering the socioeconomic conditions and population of our countries, like India alone, it has 1.1 billion, I think, and Pakistan is like 300 million. So how do we as medical students bridge the gap and come together as countries to care each other and make healthcare accessible to all? Because there is a lack of bridging between India and Pakistan. So this is the prime reason I wanted to collaborate with MSI India, because we are the people come from the same culture, from same values, and from same region, but we don't share our knowledge, our surveillance data and stuff like that. How you, as a person, a person sitting in Europe and who has been active in the policy making and the politically active conferences. So how you think policies can be changed by the government of these countries, so the people who want to work together as a region can make their knowledge accessible to each other?
Okay, well, that was a very long question. Can you write down a few points for me in the chat so that
sure.
I don't forget to answer any of them? So I think the good thing about health is that it's such a central issue for everyone, and that it really can help to bring people together just for that reason, that everyone cares about health. But as you say, it's there is especially political issues that are sometimes a bit in the way of providing healthcare, and especially universal healthcare, to the people in the way we would like to do that.
Actually, we are sorry to interrupt you. Actually, we are talking here a bit from the political perspective, because we share, I think 2,800 kilometer border, but we don't have access to each other countries. We don't allow visas or stuff like that. We don't travel to each other countries. But we eventually come from the same region. So the participant is trying to ask you how we, as medical students, bridge the gap between the knowledge and the surveillance data and stuff like that.
I mean, I think as medical students, you're in a bit in the privileged position that you are still kind of independent, and that your voice is still seen as a voice of the future. So I think it's important to really just speak up for those issues that are important for you, and to maybe like team up as like people from different countries, right? Because like nowadays we really have the means, like to, even if we can't go to places, to meet online, to work on that together. And I think that could send a very strong signal already. And what we know, unfortunately, is that politics and the governance in many countries is not the way we would like to see it. And it's not usually, or like often, it's not helpful and not focusing on health, for example. But I think what would help for you is like really working together as group, as people from different countries, and setting signals as something to bridge the gap.
Yeah, thank you so much for answering that question. That brings me towards my next question. I'm gonna paste in the chat box and I'm gonna read it for you also. A participant has asked, as health is a political choice, as it has always been. With that said, how we can, as doctors and the youth, influence policymakers and civil society towards better health?
Mm. So there is usually two ways to do that. One is from inside and one is from outside. So from inside means politics is not made in closed spaces, but there is committees, right? There is meetings, there is places where you can usually have a chance of participate in some way and to raise your voice. So as, for example, medical students have somehow a voice in WHO, like they participate in the World Health Organization and we can read out statements. And there are those ways of getting involved with politics usually in all the countries. So somehow, like for example, BBMD also has like links to the Ministry of Health and they directly interact. So if you want to change things, you can do that directly from the inside of the system. And then there is a way to do it from the outside of the system. What does that mean? That means like mainly raising awareness in the population. You can do that by demonstrations, for example, by organizing events to like raise the awareness, to get people interested, to get people informed, by writing statements, by publishing things, writing into newspapers, for example, like all those kind of things that raise awareness in the population and where you can build up pressure on the decision makers from outside of the system. If you want to do both at the same time, it's a very fine balance, obviously, because people might not want to work with you that closely if you're pressuring them at the same time from the population perspective. So it's a bit strategical. You have to see what is the most effective in that way to do. If you can do both of the same at the same time, I think the most important is that you are well informed about whatever you want to advocate for.
Yeah. Thank you so much for your answer. There is a comment in the chat box. Do you think government should revise the laws affecting climate change and be more strict in its implementation? Because the role of government is most crucial. What are the some laws, in your opinion, will affect climate change positively should the government implement it?
Yes, the simple answer is yes. And like you're exactly right. We are not stopping climate change on an individual level. What really has to change is politics. It really has to change on national and international levels. Local level action is very important. Taking the population with us is very important, but the politics has to change. And it's the role of governments. And it's actually the case that we have an international treaty for that. We have the Paris Agreement that tells us what we should do and like what we are aiming for, and that is to keep the increase in temperature below 1.5 degrees. But the issue is that there is not really a lot of international means to put pressure on governments. So they are very lazy. They're basically lazy as much as they can and try to not implement measures, because what they think is if they implement measures, it's damaging their economy. Where I have a bit different perspective, and I think not doing anything against climate change is in the very short term damaging our economy and our lives. But yes, definitely the governments need to be more stricter in following the agreement, the Paris Agreement, in trying to reduce their emissions and trying to maybe even get carbon neutral by a certain point in time. And the laws that I think that are most effective, well, first of all, it's getting out of coal. Not using coal anymore is an important one. Trying to use as the least possible fossil fuels in general, and and then investing in sustainable energy, investing in sustainable ways of transport, and basically thinking climate with every policy that you're doing. Agriculture is a big part of that as well. So yeah, I definitely see someone again is a bit loud on the microphone, so try to turn that off. Anyways, I really see the responsibility in governments and governmental actions, and yeah, it basically would just be to do what they have promised to do and what for now they are not doing.
Sorry, Laura. Vishal, can you please mute your mic? Arfan, are you in the call?
I think it's also possible for the organizer to mute people, whoever is the admin of that call.
Yeah, I'm just contacted. The person has muted himself. You can go on, please.
No, I think I was pretty much at the end. So yeah, I think it's the role of government that is very crucial, and we also need to advocate or like to pressure our governments to do things about that. And I said that, and I mean me a lot, because I'm not happy about what my government is doing. We're not phasing out coal. Anyways, the same is true for your governments. So yeah, would be good to really, for our governments to take on the responsibility they have signed up for.
Yeah, thank you so much, Laura, for reflecting on that question. Now, that brings me to my, I think that is the last question from my side, because which we received is, can you suggest few sustainable projects that we as medical students can contribute towards our NMO or towards working of the planetary health?
Mm-hmm. I think the how to hold sustainable and climate-friendly meetings is a very good one. It's not directly a product, but it's something that we all do. We all have those meetings. We have like maybe local committee meetings, national meetings within the NMOs, and those kind of things. And making them more sustainable, there is something that we can do, like using reusable stuff, you know, or like thinking about how we can decrease the amount of emissions coming from transport to the meetings, all those kind of things. I think that is something very feasible to do in the NMOs. Then I think a second thing that we can do is looking at our medical curriculum, and if climate change is included there, and if not, if there is ways to include it. Which is often not an easy thing to do. I'm very honest with you. Me and other people have been working on that in Germany for a couple of years now, and we only advance very slowly. And then another thing to do is to look for like green healthcare and what hospitals can improve. Usually there's things around waste, but also, yeah, those are mainly the kind of things. And otherwise, I think the rising awareness point is one of the most central and like a thing that every NMO can do.
Yeah, thank you so much, Laura, for suggesting a few sustainable projects and stuff, like sharing your experience with us. Now, with that being said, you're a medical student right now, working and having experience. So how would you translate your experience into the medical school as a public health specialist? Have you hold the degree for Master in Public Health also?
So the question is how my experience was in medical school with having a background in public health.
Yeah.
Yeah, it was a bit, so I did my public health studies kind of in the middle of my medical studies. I took a break and I did this master's, and it was kind of hard to go back to med school afterwards because it's so different. But for me, I've always seen it as like something that really made my experience richer, because I have the the possibilities to see things from different perspectives. I can take on my biomedical classes, or I can take on my public health classes. And ideally, I have on both at the same time, and I try to really understand problems from different sides. I think that is like the very enriching part about public health in general. And I really can just recommend to all of you to always ask with like every patient that you see, to think about what are the socioeconomic, what are the cultural reasons for this patient sitting in front of me today, because it's usually a lot more than just the medical part.
Yeah, thank you so much. I think that's all from my side. If any participants have any question, they can open their mic and ask Laura. You will have active opportunity here. So just go ahead.
Yes. No, yeah, I'm very happy taking on like any question that you might have on climate change or planetary health or anything else that related to global health that could be interesting for you guys. Or otherwise also really like hearing about your experiences with climate change and how it might have affected what you're doing or your life.
So guys, if you have any question, please type. You can type in the chat box too, or you can just open your mic and can ask. So let us know if you have any question. Okay, I think we should like.
Yeah, I think otherwise it's also fine. We like talked a lot already.
Yeah. Yes, exactly. I think we should conclude the call, and as I have just typed in the live chat box also, participants don't have any question also there. So yeah, I will again ask the participants if they have any question, please shoot, because we all are hungry and I just need to eat food. So yeah, so yeah, I think we should conclude the call. Thank you so much, Laura, for joining us for today for the session. I know you're too busy working in the hospital and juggling between your work and Gandhi, and we highly appreciated your work and your time. Thank you so much for joining us, and I will cut the call after 10 seconds if you guys want to leave.
Yeah, thank you very much for the invite. I'm always very happy to come and to chat with you guys. And I was just gonna send the resources that I had to you, and then you can share with the participants. I think that's the easiest, so that everyone can have the chance to look it up a bit. And yeah, I hope it was a bit helpful for you guys, and you got a bit of an insight in planetary health and how it's really important for, I think, all of us. So yeah, thank you very much.
Thank you so much, Laura. And now I think I will cut the call. Yeah, if you want to leave, you can. So I will wait for the participant.
Bye bye, everyone. Have a good evening.